everybody. Welcome to Ask the Expert. Today we have Catherine Paradiso with us. Looks a little funny, but we're, once again, now this is week 3 that we're having some technical difficulties on the side of our guests. But just because technology is not on our side doesn't mean that Catherine doesn't have some great things to add. So a little bit awkward in that you'll be looking at a black box, but George and my beautiful face
Oh boy.
is here today.
Unshaven Memorial Day weekend face.
Yeah, I know Catherine a long time, and she is a brilliant woman. But she had some problems in her internet today, and like a trooper that she is, she decided that we should go live anyway because what she has to say is very, very important. And so, Catherine, welcome.
Thank you.
Yeah, George. So let me just tell our audience for a moment about Catherine Paradiso. Catherine Paradiso is an adult and psychiatric nurse practitioner, and she's an assistant professor of nursing. I've known Catherine for a very, very long time. We served together on the community board, and we've served together on many civic associations, and she's always been one to give back to the community. It's a tradition in her family. The Paradisos are always involved and active in the community. I'm going to read a little bit because I think it's really important that I tell you what all those letters after her name mean. She's an alumni of CSI, where she received her first nursing degree. She received her nurse practitioner degree from Rutgers and a doctorate in nursing practice from the State University of New York, Buffalo. In addition, she provides medically assisted treatment to people with opioid addiction as a nurse practitioner in the YMCA Counseling Center for Drug and Alcohol Abuse. She's distinguished from the others in her field as a successful author and a former member of the New York City Mayor's Office, where she was appointed executive director for the Mayor's Office for People with Disabilities, and she served there through 9/11. Catherine has worked across the full continuum of healthcare, holding positions in acute, long-term home care, and ambulatory care. And as a nurse practitioner, she's worked in anticoagulation management, primary and urgent care, and women's health. In addition to her present position, she's held academic appointments at Hunter College and Rutgers University. Ladies and gentlemen, welcome Catherine Paradiso, and I could assure you, if you could see her, you'd know how beautiful she is. Welcome, Catherine.
Thank you, Letitia.
So, Catherine, I think that the audience would like to know a little bit about nursing and the history of nursing in America. And I know that you're a wealth of information on that subject. So if you wouldn't mind, would you spend a little time talking about nursing in America?
Sure, I'd love to, Letitia. So the really terrific thing about nursing is that you can work as a nurse in any healthcare environment. You can work in a hospital, you can work in a clinic, you can work in the community, long-term care, nursing homes with disabled people, home care. You can really work anywhere. And if you choose to work in a hospital, there's many places within the hospital. So for example, if you're working in an operating room and you get sick of your job, you can go work in another area, ICU, for example, or the emergency room. And you can change within acute care. So you can change your job without really leaving your organization, which is really phenomenal in terms of flexibility. The hours, the options of hours, because nursing is 24/7, make it ideal for a family life to have work-life balance. So it's really a phenomenal profession. Did that answer your question?
It did. So across the spectrum of the different areas where people can be a nurse, how does somebody become a nurse? I mean, I know that the college has a great nursing program And I know lots of young people who are interested in becoming nurses. And I know that the waiting list is really long in some colleges to actually become a nurse. And especially today, we need nurses now more than ever. Could you kind of give our listeners an insight into how one becomes a nurse?
Yes, nursing is a college degree in all cases. So there are many different types of nursing degrees a person can get. So the first level is an associate's degree, which is a basic RN. And soon you're going to see that probably go away because most hospitals now are only hiring nurses with a 4-year college degree. But to meet the need, you can still get an associate's and then go on to get your bachelor's. But a 4-year degree is recommended. After that, you can get a master's degree. And once you get a master's degree, there's many specialties that you can choose from within that degree. So, for example, you can get a degree in administration, in education, or you could get what we call an advanced practice degree, which is midwifery, anesthesia, nurse practitioner, and many specialties of nurse practitioners within that one option, or clinical specialist. So there's so much opportunity in nursing. If you like healthcare and you like people, there's so much opportunity. And even the education is flexible because now with online learning, there's a lot of different options and ways that someone with a lot of responsibility can still study and still do very well.
So I wanted to take a moment today to, actually thank the people in nursing, especially in Staten Island. As we know, there are only 2 hospital systems in Staten Island. There's the Northwell Health, and then there's Rumsey. And I think that it would be fantastic if we just talk for a moment about nursing through a pandemic throughout history, but also to give a shout out to all these great men and women in the nursing industry in Staten Island. And I know, Katherine, that you've had relationships with both hospitals and as well as at-home nursing care. And so if you could just talk a little bit about what it was like in the past, working in pandemics, and the kind of courage it takes for nurses to work in a pandemic, and the PTSD that they may be suffering because of it. I mean, I don't think everybody understands really what a nurse's job is, especially in a hospital.
So just, to talk a little bit about your initial nurse's contribution in pandemics. I just want to start by saying we've all seen the movies and the television shows and read the books about the nurses who served in the Vietnam War and World War II in Korea. So it's really a profession that has taken, that just has been present to every degree in humanity in terms of tragedy and severity. So to start with your first question about the pandemics, the Spanish flu is the one that we always think of nowadays when we're talking about COVID. It's always compared to the Spanish flu. So back then, nursing was not as complicated as it is now. There was a time when only a doctor could take a blood pressure, and nurses really did what we call basic care, washing, making sure patients have oxygen, making sure they're clean. And in the days of the Spanish flu, that's pretty much kind of what they did. But they did document in many places that having nurses available was the most important predictor of a positive outcome for a person with the Spanish flu. If you've seen the pictures or the stories about the hospitals and how overwhelmed the healthcare system was, they didn't have beds. People were on the floor. The resources were unbelievable. The government did nothing to help. So each community was on their own. So the places that had nurses who could really, kind of provide in that time when they didn't call it social distancing, but could provide a little more space, washing patients, keeping them from contaminating each other as best as possible, monitoring their progress and seeing how they were and reporting back. I mean, those were the things that nurses could do then. And when there were nurses, the patients did better. We had the polio epidemic, which was in the 50s, I think, 40s and 50s. So for 5 decades or 5 years, there was a massive polio epidemic, and nurses were front and center with that as well. That was a time when, again, we didn't have the knowledge that we have now. And that was, nurses really stepped forward to take care of the children and the families who had polio. Now, I'm sorry, it was 5 decades. I think I said 5 years, but it was a very serious epidemic in the country. And when a person had polio, they had polio initially as an acute illness, and then they were left with some degree of paralysis. So they had chronic immobility after that, but we didn't have the sophisticated rehab and the techniques we have today. So people would be in a hospital for a year or two with nursing care, and then they would go home, and then they would have to, deal with whatever deficits they had. And then, of course, once the vaccine was invented, it was nurses who brought that vaccine to everybody. We think also about, in more recent history and things that I can remember, the HIV/AIDS epidemic, where nurses were caring for patients with AIDS from the time they were diagnosed until the time they passed away. And that's a time when, if you remember, many, many, many young people died tragically. And initially, no one knew anything about the disease. So there was a terror, a fear. But yet, nurses never shied away from taking care of those individuals. And it was totally unknown. Nurses have really responded to every tragedy at home and abroad. And I just want to mention the quote unquote mother of American nursing is Clara Barton, and she started the American Red Cross. And we know that the American Red Cross has changed, or really is, I shouldn't say changed, is really a part of every disaster now. But that was a nurse who brought that to America. And we know how much that's evolved. We always look for the Red Cross now in any disaster. And over time, as science and technology evolved, so did nursing. We initially started off, as I said, doing basic care, and now we see nurses, nurse midwives delivering babies. We see nurse anesthetists intubating and delivering anesthesia in the operating room, caring for patients with chronic illness as primary care nurse practitioners. We see nurse practitioners in acute care at the hospital, and they are the future of healthcare because they're managing patients in all these environments. In the pandemic, we have really seen the depth and breadth of nursing every day as they've become not only necessary to care for every single person in the hospital with COVID, but also as an extended family member for those in hospitals and nursing homes. It's the nurse that's probably calling the patients and bringing messages back and forth. So they've been front and center and really looking at a lot of tragic and sometimes preventable disease and illness in people in their care. And I really, really applaud every single nurse on Staten Island and everywhere really in the country, everybody in the country that's worked so closely with these patients, because with the unknown, especially early on, I know that many of them were thinking and fearing that they would get this disease or bring it to their family, but yet they pressed on. Some of them slept in their cars, some of them didn't go home, but they, never shied away. And believe me when I tell you that they were scared, I'm sure.
You know, well, for me, I can say that my personal experience with nurses, not only, being your friend for so long, but because my son, Robert, was so ill for so long. And we spent 5 years, or actually, we spent more than 5 years going back and forth to Staten Island University Hospital, and to Rumsey in emergency. But if it weren't for the nurses when Robert was in emergency care or in the vent unit, or even in the rehab unit, I can tell you right now that I would have lost my mind, because Robert's book, and you know what I'm talking about with the book, Catherine, ladies and gentlemen, still to this day, records are kept, are written for the care of patients, and they make binders for the patients. And Robert had several binders, and they were rubber band together. And so if a new doctor had to come on to see Robert, or a specialist had to come on to see Robert, they'd have to read that binder. And I'm talking about hundreds and maybe thousands of pages. And the nurses kept that information and gave it over to the doctors. They were the front line for us. They guided me through, the steps of what was happening. They answered my questions. They helped me to advocate for my son. And they also became the communicator, the link to the doctors and the physicians, and keeping them up to speed. Because, look, let's face it, especially in Staten Island, when we have over 500,000 people and only 2 hospital systems, 3 hospitals. It's just not enough to care for everybody. And when you have somebody who is as chronically ill as Robert was, when a doctor comes in, to familiarize him or herself with the case, they can't possibly get through all that information. And so they do the best that they can. But the nurses are the ones that kept everything in their heads, in their hearts. They kept their records, their notes, and they were fantastic, Catherine. I mean, absolutely fantastic. And it kind of gets me crazy, and this is coming from me as the mother of a patient. It gets me crazy when I hear family members of other patients blowing up at nurses, or becoming angry, and saying, you're not paying attention to me, I need more time, and what are you doing? These types of things, and I witnessed it because we were there for so very long. These types of things, it does nothing to put forward the case of your loved one, does everything to put a negative kind of feeling into the air. I never, whether it was in the emergency room, or in the vent unit, or in the rehab unit, or in the nursing homes, I never witnessed a nurse or encountered a nurse who didn't do everything in her or his power to make sure that everything was taken care of at all times. And I often wondered, when do they actually get to go on break? But if it wasn't for their guidance and their love of their job, and the affection that they developed for their patient, Robert in particular, he would not have had the ability to come home after he was trached. We would not have had the education in how to care for him. We would not have been able to bring him home for the last 18 months of his life. So I just want to say to everybody out there, you're the best advocate for your loved one. And it is a very difficult time when you're watching somebody you love be sick, or dying, or where you don't know what the outcome is going to be. So you're going to be frustrated, and you're going to be on edge, and you're going to be just, overwhelmed. Your nurse could be your best ally in helping you, but you can't engage their help if you're not prepared to listen to their advice. And you might not like what you hear, or when you hear it, but the truth is that they're looking at things from 10,000 feet, and we're looking at as the advocate for the loved one, we've got our nose right up against the glass, so we don't necessarily see everything in the broad scope. So if you have to go to the hospital, or even in a doctor's office, I beseech you, please recognize the hard work that these nurses do, because not only do they have to deal with the family of the patients, but they deal with the family of the patients. Then they deal with the doctors. Then they deal with hospital administration or administration period. And, you know, they're the ones that are caught. I'm not going to say caught in the middle. They're the ones that link us, that link all of those areas together to make the wheels go.
Yeah,
So
it reminds me.
I don't know if you have anything that you want to add to that, Catherine.
That reminds me, not to interrupt, that reminds me of the Goodfellas when the FBI would break into the mobster's house and the wives would spit on the floor. You're not doing anybody any service by being angry at your nurse. And I'm always astounded by the patients, not the patients, the patients of the nurses to deal with that, because they're dealing with it with so many families. So it's just a point, not really a question. Much respect for anyone that can go through that much poking and prodding and still help, you know, and still maintain professionalism. It's kind of amazing.
It is. It really is. So, Catherine, before I let you go on, I just want to let everyone know we're joined by Lucille Chavone, and she has just been a great supporter of the Ask the Expert show. We're also joined by my mom, Josephine Nastasi, and Catherine. She wants you to know that she says hello. And we're joined by Lillian Lagazzo, the great Lillian Lagazzo, as Deputy Borough President Ed Burke calls her, and she is indeed great. She's got a question for you, Catherine. How do nurses address the enormous cultural diversity amongst the staff and in treating patients? So, especially because we have so many people with so many languages in Staten Island and in New York City, over 360. Can you talk to that a little bit, Catherine? How do you get through that?
Yeah, and that's a really good question, and it folds into what you were saying as you were talking about your son and your experiences and nursing being advocates, that family vigilance is very important, regardless of the setting, whether it's home care, acute care, long-term care. And we know that, you know, it's very, very, very hard to see someone you love not well. So, you know, if somebody loses their temper once in a while, it's okay. Nurses are always professional. We kind of understand that. But it's really important to know the culture of your patient, because each person has a different way of looking at healthcare and health issues. For example, some cultures don't believe in taking medication. Some cultures are terrified of pain medication. Some cultures are terrified of admitting that they're in pain. And we are trained not only in nursing school, but the hospital has mandatory training in cultural competency that, you know, we do all the time. So it's kind of ongoing. And we're also, from the very first day of nursing school, one of the first lessons we learn is to be non-judgmental. That's one of the first. I can still remember Jermaine O'Donovan, who was Councilman O'Donovan's mother, was my first nursing teacher. And I can still remember her lecture on being non-judgmental. And it's very important. So even if you don't know every little nuance of every little culture, you know what it is that you don't know. So you know the important questions to ask a patient or a family member to try to see what they're feeling. And you have to really, to be a good patient advocate, you have to be able to see around the corner for the patient. So if you know a patient is afraid of pain medication and they're about to undergo a painful procedure, you know that you have to find out how to mitigate that pain ahead of time. So it's multiple circumstances with multiple, scenarios, and I couldn't possibly, go over all of them, but you just have to understand how to learn about what's important for that person, and because their culture really is their spirit, it's their heart and soul. And we really like it when families are involved, because that's how we get information about the patient. And families can be the most supportive for a patient, or they can be the most stressful for a patient. So again, learning the differences, some of it really, truthfully, Letitia, is intuitive, and it comes with experience, where you just kind of get a gut feeling But some of it is knowledge, but it's all maturity and experience. And I hope that's a good answer.
That's a great
That's actually, it's a great answer. That one of the things that I wondered when I watch you and listen, I've seen you care for your loved ones and your family and you and us as your friend. And people should know how much confidence I have in Catherine. She's my health proxy. She's the one that if anything ever happens to me, they're going to call her and she's going to make the decision on whether or not to pull the plug on me.
You
So
didn't want to
for
give
any
me
of
that.
my
You didn't want to
enemies
give me
out
that.
there, yeah, you can't bribe her either. But I've watched you, Catherine, and I've watched you put everything aside to, and run towards, if you will, the danger. And it's interesting to me that nurses have that thing in their gut that they just have to help. And I've seen you do it, in public. I've seen you do it in private. Now, tell me something. I mean, is there a personality trait that you think makes someone a good nurse? You see students and you've been in the industry. Is there something in particular that you would say for anybody thinking about becoming a nurse? If you have this trait, it's probably the profession for you. And if you don't, then maybe, you might find it tough.
Well, you have to be able to have a sense of caring, obviously, and the desire to help people. You also have to have a sense of duty and a sense of being on, because you can't say, I don't feel like going to work today. I'm going to work from home today. Oh, it's a nice day. I'm going to call in sick, go for a walk in the park. You have to be there. You have to show up. You have to be present, not only physically, but mentally, spiritually, and psychologically. So if you don't have that kind of personality, if you're detached, you can't connect with people, you don't want to connect with people, you don't care about what's happening with other people, it's really not the profession for you. And I'll tell you that other people, other nurses, administrators, doctors, and in healthcare, we work with multiple disciplines. We work with physical therapists, respiratory therapists. It's a team, and everybody has to work together. And if you can't be part of that team and be present in the moment, and you're just thinking about yourself or where your next good time is going to be, people will sense that and they won't want to work with you. It's very much a on duty type of a job.
Well, that's your nature. I've had the good fortune to know you through the YMCA Counseling Center, but I think there's just people that are built that way, in my opinion. There's a certain segment of the population that just wants to help. Most of them, but you in particular get involved and get your hands on things, which I really respect and appreciate about you. The YMCA Counseling Center for me was a great experience. Just having a chance to participate on the board over there kind of changed my perspective on what I'm going to do with my spare time. So I think that's in your nature, Catherine. Thank you.
I think also too, there's also, again, like I said, many years ago, we didn't have a lot of opportunities of employment for women. A lot of women became nurses or teachers. And, even in my lifetime, nursing was very much giving back rubs, making sure people were comfortable. I mean, there was a lot more to it, but it was focused a lot on comfort. Now there's so much technology involved, and you have to be really like on top of your game to be a nurse in the hospital, anywhere really. But the technology, the electronic medical record, the reporting, the reimbursement, the software, the way we use software to monitor patients at home now, like it's really become a job where you have to really be on top of yourself, on top of everything to get through school. And then to be able to manage the patients, you have to be able to put all those parts together. The machine with what the patient's feeling, with where the family is. It's become a much more complicated job, a much more interesting job. And one thing that I really like is that the education is advancing. And so I think that the competitiveness, it's just becoming more of a competitive, more of a respected profession.
Well, I think that I'd love for you to expand on that. I just want to acknowledge that we are joined also by Susan Colford Castano, who going back to the fact that the need for cultural sensitivity is so important in nursing, especially in a city as diverse as New York. That was her comment on that topic. But for a moment, I just want to kind of talk about, Katherine, the changes you've seen in nursing, because now how many years have you been in nursing?
I'd rather not say, Letitia. Let's say many. Let's just say many.
Many. Okay. So in the time that from when you first entered to now, I mean, so many things have changed in healthcare, right? I mean, and we've seen it in the medical profession where documenting everything has always been very important, but now more than ever, their government is kind of inserting itself into the medical profession, and so the stress on doctors, and hospitals, and to keep notes, and to guide and to be guided by certain treatment methods. I mean, do you feel like the amount of oversight that has been coming down from government to the medical profession, is does it add more than time to a person's day? I mean, in other words, has it changed in the past where you were able to diagnose and treat without all of this technological interference? Was it easier then, or do you think it's easier now with all the resources and technological? I'm not going to just call it interference. They are resources as well. Can you compare the two? I mean, so much has changed over time in what we know and how we proceed. But what was the difference between nursing then and nursing now?
Well, nursing and healthcare has evolved with the times, right? So that, years ago, a doctor could admit a patient into a hospital for arrest. They used to admit patients who had to have multiple tests, and you would have all those tests done as an inpatient. So, as things have changed, things have gotten better. I'd like to say that the quality has gotten better. When you question about the government oversight, I think that, some of those things are actually good things, Letitia, like quality improvement and quality reporting has been a very positive thing that came from Medicaid requiring that providers report and then get reimbursed on those things. It's made people pay more attention to details, let's say. And I understand like the question about government interference and oversight. It is a little daunting to have to send reports in and to think that people are watching you, and to know that Medicaid can take money back from you if you don't do things a certain way. But it's not so bad to have some quality reporting and some standards in the country. I think the bigger problem is liability and lawsuits, because you do see people practicing in ways to prevent legal interference as opposed to government interference.
Oh, that's interesting. That's interesting.
I see that people, just to kind of dumb it down, every headache doesn't need a CAT scan, but every provider could order a CAT scan for fear of the 0.0001% of the people with headaches that might have a brain tumor. There really is a certain paranoia, and it's very much evident in everybody's everyday practice. And people, you hear it all the time. We have to do this, write it this way, do it this way, because in court, because if I get sued, because my malpractice provider, all of these things really do take away attention and quality. And, I find that more burdensome. The government stuff, I think, there have been times in my career where I've said, we have to spend $100 to make $101. Sometimes, sometimes things, are that way. I guess I'd have to say that some of it has been kind of bad, but it hasn't all been. I think some of it definitely has improved quality and accountability. and add, value-based medicine, right? Add value to your visits.
And that's really important. And I one of the things that I'd like to get across to the people that are watching is something that you touched on with that answer, which is that because the government is now involved, there's a lot of questionnaires that go out, right, to healthcare providers, especially in hospitals and large clinics, so that after you've seen the doctor or after you've been in the hospital, they ask you to rate the service there. And people are paying attention to the hospital and the service that they're getting when they're ill or when somebody they love is ill. But once they get home and that comes in the mail, they don't necessarily fill it out because now they're too busy with life and they're well again, or the outcome, whatever it was, had occurred. And so they don't necessarily feel the obligation to fill out that form. And to me, I feel like it's almost like the census. So and believe me, I filled out that form many, 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 many times for Robert and for myself because I'm quite accident prone and I spend a lot of time in the hospital. But that form to me is so important to get in because without that feedback, the hospital and also the government can't say, look, we need to improve this or that. And so I think that it's as important as the census, and I think people should be filling out the census and that form. So my question to you, Catherine, and I know you were in administration for one of the major clinics, do you think that people are paying more attention to those forms these days? And what would you say to encourage people to fill out those feedback forms?
I think you're right about that, though, Letitia. People who are busy don't have time to do it, but it is very important because, again, it's satisfaction data, right? So it helps places improve, but it also does go to reimbursement because it's part of the value base, all right? So, it helps for the providers and the hospitals on their reimbursement to have good data on those forms.
And so that's something else for people to consider. I mean, look, the one thing about the local hospitals is that, they're here to serve us. And I can't tell you how often I hear people say, oh, I'm going to Manhattan. I'm not going to Staten Island for my surgery. I'm going to Manhattan. And they do. They leave Staten Island and they go to Manhattan for cancer treatment, for heart treatment, for so many ailments, chronic ailments. But if Manhattan can't cure you, I've seen so many people get bounced because they didn't fall into the success rate box that some of the Manhattan hospitals wanted to achieve. And so, the doctors would say, look, we've come to the end. We can't do much more. And so that person comes back to Staten Island. And when that person needs then care again and again and again, they no longer go to Manhattan. They come to the local hospital in Staten Island, and that may be where that person finally dies. And what winds up happening is the Manhattan hospitals take all the glory because they keep that cure rate, right? Yeah. Oh, here's how many successes we've had, and those people who return back to Staten Island who ultimately didn't have a great success outcome in Manhattan, they die here, and that kind of becomes a statistic in our local hospital. And I know that we have some fantastic doctors. The Cancer Institute in Northwell is fantastic. I know the heart unit is fantastic. Rumsey's fantastic, and I beseech people to have some faith in their hospitals and see what actually can be done here on Staten Island, because at the end of the day, they're going to be the one that cares for you. They're going to be the ones that are there for you for all the in-betweens. And we can't get better, right? As a hospital system, we can't do better as a hospital system unless the people in our community actually, partake in the services that our hospitals give. And there's no service that our hospitals in Staten Island can't provide. Isn't that true, Catherine?
We pretty much have everything here on the island, and both of our hospitals are very community centric. You know, they've been part of the fabric of the community for I don't know how many years. And, you know, I've had people say to me that they feel like they're at home when they're at one hospital or another, as crazy as that sounds. But the care is very good here on Staten Island. And, you know, again, I can't speak to what you just said, Letitia, but I think that's a conversation for another show. There are things in Manhattan probably that we don't have, but pretty much everything that I can think of, we do have here. So,
Okay.
Yeah,
Well,
I think that's a market.
we have good nurses, that's for sure. We have good nurses in both hospitals.
Yeah.
Hey.
And that, I'm sorry, George.
I have a question for Catherine. I love asking this question of people that are service minded. When was the moment you were like, I'm going to be a nurse? What made that decision happen? Was it a moment in your life, or was it accidental?
I can't say that I had one moment, George. I mean, I grew up with a great aunt who was a nurse. She was an influence on me. And when I was, time to graduate high school, it was like, what are you going to do? And I was like, oh, well, I'm just going to be a nurse. There really wasn't any second thing that I really ever considered.
All right, thank
That's
you.
fantastic. It's great to know. It's great to when you have that in your heart. So Karen Lascala joined us, Catherine, and she says thank you to you, Catherine, and all nurses that work endlessly during this unprecedented time. And that brings to mind something you and I discussed offline, and I'd love for you to talk about a little bit here. Is the unintended, I guess, consequences or the health problems that evolve relating to working in a pandemic. PTSD being one of them, but Catherine, maybe you could expand a little bit. I mean, what are we seeing, or what can happen when so much pressure is put on a nurse?
So, okay, and I just want to give a shout out to Karen Lascala, who just called in. Karen was in charge of the emergency response for nursing for the entire Veterans Administration for the country. So
Wow.
there again is another nurse in a
There
very
you go.
strong leadership position responding to tragedy.
Thank you, Karen.
So your question about mental health, was that what it was, Letitia?
Yeah, it was the I guess the what the result of, or what health problems do you think may have evolved from this pandemic, especially mental health?
For the community, I think there's a lot, and I'll get into it in 1 minute. But I just want to say a word about the nurses who have taken care of all these, have been surrounded by all this grief for months. I mean, you remember we always think of 9/11 and how horrible it was, but it really was over in a couple of days. And the families, of course, it never ended for them, but for the providers and for the emergency responses, we did kind of move on as a society. But this has been, every single day, day in, day out, for these people who are working with people who are so sick and dying and can't be near their family, and their families can't come in with them, and having to be the extended family for these patients and watching the grief and the death day in, day out has to have taken its toll on the nursing staff. I've spoken to many myself, and I do see a threat of some, PTSD, and there's counseling set up, of course, for everybody. But, nurses, again, the heroic side of them is to just keep moving on. But it really was a very emotionally searing and powerful experience working around all this grief for such a long time, and to have to leave your family and leave anything that was pleasurable at home. And then when you came home, to not be able to go out and have a drink, or, to go to a movie, to just have to stay home and think about it constantly, I think it was really very, very difficult. And as far as for the rest of the community, I do see some things occurring. I mean, anxiety is something that every single person experiences at some point in their life, at some circumstance. Others have, different situations and things that make them anxious, but it's a very powerful emotion. Anxiety is almost always accompanied by a level of depression, and over the long term, it can cause high blood pressure. It can cause problems with weight. Some people overeat, some people don't eat at all. It can exacerbate the need to use substances. And let me just say that we've been fighting an opioid pandemic right next to this pandemic, because the
Yes.
opioid pandemic has been with us for a long time. And those people are now, staying home or doing their jobs, whatever. But this has really been a double hit for people in that world. And again, the anxiety can cause so many problems. And I think that one of the things, it's not only the unknown about the virus and having to stay home, and I think there's a feeling that every level of government, in some way, while people are trying to do the best they can, there's a certain sense that every level of government has failed us, and the press as well, because there's so much personal agendas on the television constantly, on social media. It makes people feel that there's no confidence in their leadership. Therefore, there's no predicting what's going to happen in the future. Am I going to have a job? Am I going to have money? Is my husband going to be healthy? Is my child going to be healthy? I mean, all of these things, really, for anybody, even those of us who are strong, are having anxiety. So I think that the mental health thing from this is really a serious problem that we're going to be dealing with for a long time. And then the other piece of collateral problems is the chronic health issues, and people having to follow up and do telemedicine. And, you have these old people who are home trying to do Zoom meetings, just the quality is not the same. You have other people ignoring acute care issues for fear of entering the system. I know somebody who smashed her head. She probably would have went to the emergency room under other circumstances, but didn't because she was afraid to use an emergency room. I know several people that had minor things that may have, driven them to an emergency room under other circumstances. So, I mean, I can't say for sure, but I'm sure there's more serious cases. So, I mean, that's what I see. And I see again that people who know nurses, people who have a nurse in their life, will call that person to ask them what to do all the time. Nursing is the only profession where human touch is really welcome.
Yeah.
So I think that, we've had a tremendous impact. I'm hearing my voice come back to me,
Yeah.
Letitia.
That's interesting.
No, you said that the point about people being afraid, that just happened to me 2 weeks ago. My girlfriend fell, cracked her head. We think possibly fractured her arm, and I was in a complete panic over the thought of leaving her alone at the hospital. So we decided to call a friend.
Mm-hmm.
Yeah, so I think that's going on a lot, and it's
Yeah, and think of people that you really can't leave alone, like George. Like, your girlfriend probably could have fended for herself in some, capacity, but you have people with disabilities, people who are blind or deaf, or can't walk right, or who are old, and they've been home, and now they may need to use the system. To have to do that without another person with them is horrible.
scary.
It's almost impossible. I couldn't even imagine what it would be like if Robert was still alive and he had to go to the hospital at this point in time because he was not communicative. There was
Mhm.
no way that anybody would have understood what was going on. So it would, we would have had to make the proper arrangements, and we would have turned the place into, upside down. But my mother right now, Catherine, just before we got on air, my stepfather fell yesterday, and he wound up. He's at the hospital. The ambulance had to come to take him, and they wouldn't allow my mother to accompany him. And right now she is stressing so much, thinking of him in the hospital by himself. And it's so ironic, I guess, because as she was becoming riddled with anxiety, I said to her, Mom, there are going to be nurses there that are going to just adore him. They are going to care for him. They are going to take care of him because he's a sweet man. He's a good man. And not one nurse would not give their heart to him and make sure that everything is okay. And they will call you and they will help you and they will give you information. And I reminded her that you were coming on today, and she took a breath because, she said, no, it's true. It's true. If they're like Catherine, I know they'll take care of him. And it's just, nurses are a source of comfort for so many of us. And I'm so grateful to those that helped Robert, and to you, Catherine, who helped so many, and to you, Karen, and Susan, and all the others that are out there that are nurses and that give of themselves. And one thing, Catherine, that you said when we were talking about nurses' concerns is, they go to that hospital every day and they come back and they not only worrying about themselves becoming sick, but bringing home this virus to their family. So they worry on two levels, and God bless their family for supporting them through this, to do this kind of work and to take that risk. It's really, really scary. It just blows my mind that so many nurses continue to run towards the danger.
That brings up a question for me. What could you recommend for everybody out there watching, and myself? What's the best way to thank a nurse right now?
Well, I guess just to say thank you. You could write letters. You could always write a letter to the administrator. You could write a letter to them. But I think just really thanking them. I mean, they're not really ever looking for anything more than that, to tell you the truth.
It's simple enough.
You can make a donation. You could always make a donation in their name to the Red Cross or some other local charity.
Yeah, because I see, everyone's going crazy, wanting to show their love for nurses. And I don't know if anyone asked that question, so that's why I brought it up, because
nobody's answering that, but now I'm thinking about it. I'm thinking if it was me, you really can't take anything in terms of a gift without feeling really awkward. So, I mean, I guess a donation to help another person in that person's name would probably be something nice.
I think that's a great idea, Catherine. I think
I understand the sentiment. I'm sorry to interrupt you, Letitia, because my mother was in the hospital for months, and my family was very appreciative to the nurses at Staten Island Hospital for how kind they were to my father and to my mother. It was just, they were very, very kind. So we couldn't think of anything else to do, but we kept feeding them. We kept ordering food for them.
And isn't that great though? Because who the heck wants to eat hospital cafeteria food? And I know if my nephew is watching right now, he's a chef. He's a chef at Staten Island University Hospital. He does a great job, and it's improved terrifically. But really, how often can you just eat that? And especially in a crisis like this, when you're on shift, maybe 3, 4, 5, 6 days straight without getting a day off. So food is I always found when I brought food, they were very happy about that.
Yeah, and I think also too, the clapping and the outpouring and the signs of thanks is also very uplifting for them.
Yeah. I know that one of our clients, Barry's Auto Body, had been offering free car washes to people in the healthcare industry, and I thought that was fantastic for Barry and Michelle Krupe to do that. So I think that Staten Islanders have come up with a lot of great ways to thank our healthcare professionals. But Catherine, I love your idea about making donations to the Red Cross in a nurse's name. I think that's so special.
Well, it doesn't have to be the Red Cross, but and any one of their, it could be the local, the hospital, the hospice, whatever. But Lucy Chavone just texted in, and she's right. A letter of commendation for their personnel file is something that you could always do, because that goes into their personal record.
That's a great idea. So you know what? All right, I'm going to actually start something here that nobody knew I was going to do, but I'm going to build on what Lucille just said.
I smell work coming.
I know anyone who's listening to this podcast, I would say that we should all write letters to the administration of Rumsey and to the administration of SIUH, Northwell Health. And I mean, we can't possibly know all the nurses there, but we could deliver one big thank you letter to the hospital on behalf of all of the nurses that worked through the pandemic, and have them included those thank you letters in the file, because the truth of the matter is we would not have gotten through this if these men and women didn't report to work every day. So, Lucille, I think that's a great idea. And I think as a community, we should all write one. And it takes 10 minutes, folks. 10 minutes. And as a matter of fact, the address is in the phone book. Just, I'm not sure. Is it the chairman of Rumsey is Kate Rooney now, Catherine?
The chairman of the board is Kate Rooney. The CEO is Dan Messina. And the chief nurse is Rosemary Stazone. So,
and how about Northwell? Do you know who's sitting in all?
I don't know who the chief nurse is, but you can just get it online.
Right.
You know,
We have Dr. Adalik.
Dr. Adalik is the chief, the CEO.
Yeah, Dr. Adalik. And I know that they had a change in leadership at Northwell for the chairman of the board, but it is online. So, address them and just a quick note to say thank you to all the nurses, or cards or whatever to the hospitals. I think that, Lucille, that was a great idea. And Catherine, you had a really fantastic idea too. Remember, and it's not just the nurses in the hospitals. We have nurses in all of our nursing homes. And, Catherine, maybe you could talk. I'm not going to ask you to comment on exactly what happened in the nursing homes, but maybe you could talk just a little bit about what it's like to be a nurse in an older care facility, and the difference dealing with people with disabilities and super seniors, as opposed to being in a hospital setting, or what's special about working in a nursing home.
So when I went to my first nursing home job, my very first nursing home job was as a nurse's aide when I first started nursing. And many years later, I went to Seaview Seaview here in Staten Island Nursing Home. And of course, the perspective was dramatically different. I had all this knowledge and all these years of experience, and I thought I was going to the easiest job in the world because I was going to be working in a nursing home. And it turned out to be so unbelievably challenging and hard. Nursing homes are so regulated, and they call them a nursing home because it's nursing care. Nursing is what goes on there 24/7. More than any other discipline, it's nursing. So the regulations for nursing are unbelievable, and the state comes every year to look and see every little thing that you can imagine. So it was really it's a very hard. It's also emotionally very hard because you take care of the families and the person, and having to place a parent in a nursing home or a child in a nursing home or any family member is a very, very, very hard decision and really wreaks havoc on people. Even when the outcomes are good, it's very hard to leave a person's home and see them go into a nursing home. And once they're there, it's the staff that's their extended family, and you really do begin to assume those patients as part of your extended family as well. You know everything about them, really a lot of details about them and their family member, and you become so accustomed and acquainted and attached often that I can't imagine what it was like for all these poor nurses that had to watch all these old people die without having their families with them. It must have been really comparable to something you'd see in a war. It had to be horrible. I think about it. I have to tell you that I really do think about it every day, and I was actually thinking about it every day from the very beginning, because that experience of Seaview has stayed with me. The closeness of the people there, and it's again it's all nursing. So you know, it's a different type of care. The patient lives there, so you're in their home, and that's, you know, you're taking care of every little walk of life, their hair, their nails, their, you know, their food, their nutrition. And you don't have a lot of RN nurses. It's nurses aides that really do a lot of that. They do
Yeah.
all the heavy lifting
Yeah.
there. So the
Yeah.
nurses are the leaders and the supervisors, and they, you know, they make sure the medications are all taken care of, and that type of thing. But it really is a true place where, I don't want to say doctors are just there for legal purposes, but it's really 100% nursing.
Yeah.
And you know, it was
Yeah.
really tragic what went on.
Well, so we're going to end on that note, and I'd like everybody to just think about what Catherine just said about those nurses and nurses aides that are in these elder care or nursing home facilities. And tonight, you know, say a prayer for them too, especially because the truth is, as Catherine said, you in this pandemic, nurses were the ones that have been holding people's hands through the good and the bad, and when family members couldn't be around. So every nurse everywhere, whether they're taking your blood pressure in your doctor's office when we finally open them all up, or whether they're giving you information about a loved one that is in the hospital now, or whether they're taking care of your parents at a elder care facility, or if they're helping you with drug treatment. Take a moment, say a prayer every night for these men and women, not just today, but always, because they've been here for us throughout history, and we need them to continue to be here for us. Catherine, it has been a joy. For those of you that didn't know, we had some technical difficulties, and we managed to put a picture up of Catherine, but she's been a trooper, and she's stuck with us through all of this. So, Catherine, thank you so much for
Thank you,
everything.
Catherine. Thank you.
Letitia,
And don't
thank you very
forget,
much for having me, and I really thank you so much for putting the spotlight on nursing. Thank you so much.
God
thanks.
bless you,
And,
everybody.
and don't forget, everybody, like, share, subscribe to our channels. We're on YouTube, Facebook, Instagram. You know, help us spread the word so we can keep these shows going. Thank you.
Okay, and Monday's show is going to be Wilson Henderson, an original veteran of the Stonewall Rebellion Veterans
That's going to
Association.
be fun.
That's good. We're going to be talking
The
about
mention
as he calls it, the GLBT in New York City, and actually what started the GLBT revolution. He was actually at the Stonewall Inn, and he's got some great video of some great stuff that went on in the Stonewall Inn. So tune on Monday, Memorial Day at 2 p.m. and as we get ready for Pride Week.
Take care.